this is gone. And I ask that it disappears onto the other side, just in case. No, because Siri talks to you. You can take it in away. I put it on airplane mode. Welcome to everyone. I think for all of you who are online, welcome to our session. My name is William, as I said. Today we are on a webinar on the future of human resources in the new digital age in the health and pharmaceutical sector. We're doing it all the way from Lagos. For all of you joining us all over, you are about to experience the knowledge sharing platform from our campus here in Lagos. Without any waste of time, let me welcome my speakers to come on stage, and then we can ask them to introduce themselves, and then we can get on with the topic. We will have about an hour and a half or so to engage with this topic on the future of human resource. Let me also acknowledge the office manager, the country manager Vivian Okoye is here, and I'm sure people in the room also know her. Otherwise, at the end, she will do the closing remarks and then do the pleasantries. Let me welcome Yolanda Kakwa from Eurocare. Is that Yolanda? You correct me if I'm wrong. Yolanda Kakwa. Is it? All right. Is Yolanda? And that you can take a seat anywhere, any one of those that you feel comfortable with. I've put all 6 of them for you, and you are just to choose because Abdullah Kadri Basuma from HCI Healthcare. Welcome, sir. Abdullah Kadri. Okay, that's somebody repeating me. Faith Nelson Ojaga, Group HR from Avon Healthcare. Right? Welcome, ma'am. Imam Essien, Head of Human Resource, May and Baker. Imam here? Not here yet. Imam, okay. Imam joins us, we will introduce Imam again. Adeyinka Amusu, HR Executive from Dotum Company Limited. Dotum. Okay. Thank you for correcting me. Dotum, Datum, Dotum. Oh. Okay. Olumide Rubaike, Director for Adam and Eve Communication. That's supposed to be easy. Adam and Eve. I think I must change chairs. Huh? I must give you this. Are you sure? I love that. Okay, good. So they must give me an awkward chair. You must have the best chair. Okay. All right. Welcome, welcome, panelists. So I hope I haven't left anyone. Okay. So when who am I missing? Missing. Okay. Ernest, please join us. Vivian, please, can you update? Because I don't have. Yeah, you can take that one. Because then there's another person who's joining us. You see my counting. I was right with my counting. Yeah, it's okay. I'll keep standing. All right. Welcome, everyone. I trust that this session will be as informative as the other sessions have been, and we can be as interactive for people online. I will lead the questions as our panel has received a set of kind of broad-based kind of questions that we will want to engage with. But what we will do is we will allow you to ask your questions at the end of the session. We'll leave about 15 minutes and keep your questions ready, and we will hopefully be able to get to all of them. So it's M Pharma, right, Ernest? M Pharma. All right. Okay, so pharma stands for pharmaceutical. All right, so you make all the drugs. You sell all the drugs. Okay, you don't make them. Okay, good. All right. So health and pharmaceutical industry, a very huge sector. I guess in Nigeria and across the world, we know when everybody talks about the well-being of every society, it's either health and education come first. So you guys are in a very important sector. I would imagine you know that means if we don't have healthy people, you are the ones to be blamed. Okay, now we at Regenesys always say that people must take responsibility of their well-being. So we teach this notion of personal mastery, where you actually first have to start responsibility for your own life. And the one thing that people don't get in our facilitation easily is this notion of spiritual intelligence. We say it starts first in the sense of purpose and meaning. So spiritual intelligence, not religion per se, but a purpose of meaning. Why are you on earth, right? And then we then say, once you're here and you're doing business, you need to have a good understanding of your relationships. So spend a lot of time on this thing called emotional intelligence, which you HR people use it a lot when you deal with employee engagements, right, labor relations, and all of those aspects. Because we have to be able to get working relationships. That's the only way we get things going and performance going in the organization. And then, of course, we recognize that everybody has a rational intelligence IQ at standard, except that it has been abused in the past. Some people thought, some are geniuses and some are not. And we only appointed, which was the mistake of many of us in HR. We used to appoint people on the basis of their IQ. But then they did not necessarily make companies successful simply because of their IQ. Some of them had serious personality disorders, and they destroyed people's lives, right? So we bring all these intelligences together, but we don't forget one, which is physical intelligence. And this has become big in the recent past, because it's just looking up after yourself and your body is critical, but that space has been expanded. We now all want to understand the body, how the cells function. Everybody's on supplements, one supplement or the other. People have gone back to traditional methods of the food and the roots that are in their gardens and in their communities. So Regenesys is like, let's tap into all of these things. Let's get people to understand all these intelligences for them to become the best employees, the best managers, and the best leaders in the world. So today, we then challenge them by within the human resource space by this notion of artificial intelligence. So a couple of years ago, we came in and had a similar webinar in this building. It was just before COVID. And we were saying, but what is this fourth industrial revolution coming with? And then immediately there was a move to fifth industrial revolution. So that COVID thing changed significantly how we do business, how things are done. So today we want to reflect back and say, well, how has things been? Has there been a difference, particularly for you in Nigeria, in the sector? Has the sector moved? Are we taking up the opportunities to use AI? Is it still very much a challenge? Are people still scared of AI tools? Other companies, if you look at them, including the public sector here, really latching onto these AI tools. And what is it that we can do? What does the future look like? So this is basically a sense of our conversation today. Where are we with this HI and where are we going? Now, I know that some of you are much more HR people and others are more, I think, communications, right? So I don't know if there's anyone, as the mic is the only one there. Anyone who wants to just give us a sense of what is the health sector like in Nigeria? Just give us a context so that when you talk about this, for people who are online, they need to understand your context. They might not understand the health context in Nigeria. And is it a thriving sector? And what are the major challenges right now that you're facing? So that when you talk about recruitment later, we know what we're dealing with. What is the context? Anyone wants to make me a context, please? Please, and if one wants to add, please we will pass on the mic. Yes, just pass it on. Thank you. Yeah, so.
Okay, good morning, everyone. My name is Yolanda Kakwa from Eurocare Specialist Hospital. So just to give a brief background where I'm coming from, I started in the aviation sector. I moved to the oil and gas. And not until like last year where I joined Eurocare Multi-Specialist Hospital. And my HR experience more than ever has been challenging because the sector is a very unique one at that. It's totally different from the aviation sector, the oil and gas sectors that I've been in terms of there's a recruitment challenge in the sector where there's a gap in talent, in skills. And it's owing to the fact that people are relocating, moving to other countries for greener pastures and so so that's the biggest challenge I would say that I'm facing in the healthcare sector. It's just the gap, the talent deficit that we're currently facing. And it's hard to fill these roles in the health sector because the level of education, as whether we admit it or not, is slowly declining. And we're not getting the best quality of hires in the healthcare industry because it's such a specific, unique. Not everybody has the skill sets that a perioperative nurse has. These are very unique skills, and it's difficult to find. And even the ones that you get, the quality, there's this huge gap in terms of skills. So I would say that that's the biggest challenge that I've seen coming into the healthcare industry.
Okay, let's give Amen here. And so also maybe you can use the opportunity to introduce yourself, introduce your company and what you do and what you see as the major challenge in the sector. I'm moving away just in case there's a microphone.
Okay, yes. My name is Adenka Amusu, and I currently work as a HR executive at Dutton Company Limited. I have experience spanning over 5 years in several sectors across Nigeria, like tech, health, construction, as well as the logistics sector. It might be much, but I've been able to pick from here and there, and garnered enough experience to be able to be sitting here to also pour out my views on what the health sector is like. Yeah, I hold on to what she said, that it's a bit tough finding the necessary skills for I was in the pharmaceutical sector, not necessarily hospital, and it was not easy having to get all the necessary skills, especially good pharmacists, good healthcare assistants at that point in time. Another thing too is that most pharmacists may not want to, from my point of view though, may not want to pay as much as they ought to, so it tends to hamper on the recruitment process where the person is coming in and saying, I want to get this amount, and the organization is like, okay, we cannot afford that for now. So from my point, yeah, recruitment is pretty tough. And also the modification of bringing in of AI into the system, it can be quite expensive. So the organization having to accept that change is also a challenge. So for ways that we try to inculcate that change into the system was having to constantly communicate that change, that this is what is going to happen. If this is coming, this is how it's going to make things more efficient for us in HR and all. So
okay, thank you very much. Welcome, ma'am. Abdul, let me pass on to you whilst the mic is moving in that direction. So again, you can also introduce yourself, but also maybe talk to whether this transformation is happening or not, because your focus has been for the longest of time transforming HR operational efficiencies. You're supposed to be smiling because of AI is supposed to be giving you everything, right? That moves us from the traditional HR to where we are right now and where we're going into the future. Your opening remarks and just a bit about yourself.
All right, thank you. My name is Abdulkadir Husuma. I have a background in medicine, a trained medical doctor. Started showing interest in people and process at some point because of my personal ambition of being an entrepreneur and a CEO one day. So I started showing interest in people and then process. So that got me into getting into a lot of trainings in HR, even though, I'm not like an HR person. So I also got involved in consulting, performance management and all, for some other companies in oil and gas. No. So, but coming to the health sector, because this is a sector where I was trained. So I hear my colleagues here have said, co-speakers, they've, spoken about some challenges that is expressed to recruitment, I also hear about compensation and all, but the challenges in the healthcare sector actually is broader when it comes to HR. It's from, talent acquisition to succession planning, performance management, and then learning and development. So you have all these challenges in healthcare sector. Now, this is because before now, people were actually not paying so much attention to the people aspect of the people management aspect of healthcare sector. So everybody just believed that you just need to go to school, you're a medical doctor, or you're a pharmacist, you graduate, you can handle your own things. But it's getting more complex, and then people are beginning to realize that, look, for you to actually be successful and for us as a country to be able to compete with, imagine third world countries, our African counterparts, and even the world, that it is important that we begin to pay attention to the people aspects, in healthcare. Very recently, a lot of hospitals in Nigeria are trying to get, accreditations, international accreditations like the COSASA, trying to get JCI accreditations. And one key element that a lot of them never prepared for is they actually want to understand your human resource management practices, the governance around human resource. So with AI coming, I think it's going to enable a whole lot of these processes in HR that has been very difficult, to implement in the healthcare sector. So I see AI as a transformation tool that's going to help a lot of human resource practitioners to be able to break that genes in the healthcare sector, particularly as it relates to people management. Thank you.
Okay. Great. You're also a transformation person in HR, right? How has this transformation been, let's say, in about the past 5 years or so? What has it been like? Has it been like the easiest thing that now you've just experienced with AI, or has it just been an uphill battle within the sector?
Thank you. Good morning, everyone. My name is Faith Nelson Ojaga, Group Head Human Resources for Avon Healthcare. Prior to Avon Healthcare, I worked as a HR transformation consultant, one of the big fours. I've also had the opportunity to work in banking, insurance, and telecoms. So now healthcare. So I guess ours is a bit different. So I've had points of view from pharmaceuticals and as well from a medical doctor, but we are coming from the HMO sector. And so, just as my colleague had said, you have that challenge where we also, of course, at HMO, you also have medical doctors and you have nurses. So you have them working with providers, you have them working with enrollees. So which also means we're also facing the challenge where you have doctors living in the country and have nurses living in the country. And so you're struggling with both the hospitals, the government also get doctors. And ours is a bit peculiar because you have, when you come into the HMO, when you have a doctor or a nurse coming to the HMO sector, they have to learn the sector, they have to understand the sector. And then when you do all that training and then onboarding, and then they leave. So you can imagine the cost, tied to having to do all this learning and then they leave. And of course, a lot of them are leaving. So you always have that continuous sourcing, and recruitment of medical personnel to support the business. How has it helped?
It's still ongoing. It's been a bit of a challenge because when it comes to change, sometimes change is difficult. So, but I think one of the roles HR has to play and will continue to play is one, deliberate training, and that communication should be open, where you are letting people. There's lots of communication about AI. Everybody gets that training, understanding just the basics. Data analysis, for instance, is important. So when people are coming to the business, everybody has an opportunity to have some basic training about fundamentals, even in Excel, in data analytics and BI. So everybody just understands that. So it's something we take. It's really important and critical for us when people come into the business. And then just maybe for HR itself, it has actually helped us in recruitment because when you're using AI enabled tools, it helps you in terms of maybe predictive analysis, where you are able to use a lot of data and say, okay, what kind of skills do we have? One in our company and even outside. So you can see a trend. So we're able to see, okay, in certain roles, even beyond medical personnel, what are those roles that you flight risk? And so we're able to plan better in terms of, for these roles, then we need to have a pipeline of people. We need to know where to get these people. And even when we have the data around the people that apply to us, we have resumes, we can see, we can able to get AI enabled tools help you actually to screen a lot of information, a lot of CVs, and actually can tell you quickly, because our business, when you're in healthcare, especially in HMO, it's actually kind of fast, very fast paced. And so we're able to use AI, one, to actually screen resumes quickly, have the opportunity to see what candidates have the opportunity or can succeed in an environment. So using their resumes, if you go using as far as using their social media, LinkedIn, AI can help you use all that data and help the screening, which is more efficient for us and which is faster. So there's a lot of process efficiency around using AI enabled, especially for recruitment. Even when you're talking about even learning and development, it's something we're actually deploying now, where we're able to, using the data of staff from performance management data, AI enabled tools can actually help you to develop and customize courses suited to each individual, which can say, okay, this is where, once you've charted the path for an individual, a development plan for an individual in the organization, AI enabled tools can help you to actually say, okay, training customized to this person that can help the person's growth and development, keeping in mind the organization's business goals. So maybe I'll stop from here for now.
Okay. Thank you very much. That's a question, Mama. Please, let's do the same introduction and your opening remarks on this.
Okay, good morning, everyone. My name is Udimidi Odegbaike. I'm the CEO of Adamani Communication. My area of specialization is actually digital marketing, digital positioning, digital transitioning, on and on. And I've been doing this for quite a number of years, safely about 15 years. My own point of view is going to be like from where I'm coming from, but I'm going to be looking at what my colleagues have actually said too. The HR profession is a very, very, very sensitive position in the sense that we know that the HR managers and professionals themselves are hired, which presupposes that the hiring system will need to look deeper into what correlates with what they will be doing and what solutions they are actually looking at. This is so because the HR professionals, they are the bridge in the organization. They seem to be the ones to pull all the other arms of business together. So we're now looking at their position in the healthcare sector, particularly the pharmaceuticals. The pharmaceutical deals with lives.
So it becomes core priority, like we all have agreed. And bringing AI, or we tend to just look at it as artificial intelligence. It's actually human, that built this intelligence. So it's a library of human intelligence, pre-programmed, to bring solutions to things we might not be able to attend to with speed, and to also bring about accuracy. So it is seen that most of the people they develop this cold feet when they hear that AI is about to take over. That's the word all about town. So there's always this insecurity about AI, but we shouldn't be looking at it in that direction, because AI, they're servants, and they can't do anything without getting prompts. So the prompts they get determines the quality that we get when we use AI. A, B, C, D companies and organizations could use AI, and you get different results. So the use needs training, which is where we should also be looking at. It will require a whole lot of training. And when we look at the burden put upon the HR professionals, it's quite huge, especially in the pharmaceutical industry, because, like one of my colleagues just mentioned, most of these new graduates tend to make certain demands that some of these pharmaceutical industries cannot cope with. And again, there's scarcity of adept skills. It's so scarce. For instance, one of the things that will define and shape the future of this HR industry, HR profession, is the skills that people will be coming with. One of those major skills is ATMP. ATMP is a skill that is so scarce, probably because of the depth of the study. But there are some of these candidates that have the skills, and they cannot be found on radar, using default means of HR practice, and so we see that into the future, there will be need to step up the skill for search, step up the skill for selection and shortlisting. So those particular skills being scarce brings upon a burden on the HR system that is either a step up or we stay stagnant. So most organizations might end up being stagnant if they don't move with the age. We call it digital age. There's been stone age. People moved with the stone age. Industrial age, people moved with it. So we're in digital age. No sector can afford to stay back, let alone the health sector. There might be one or two more points that I would like to register, maybe with the time. Thank you.
Thank you so much. And that's in the pharmaceutical industry, what has the transformation been like? I'm sure this is an industry that learns fast and does things very quickly. And I'm sure AI has been the best thing ever that has happened to you, right?
Okay. Good morning, everyone. My name is Ernest Gwasa. I'm SVP Planning and Procurement for Pharma. And I've been in a couple of industries, fintech, e-payments, e-commerce, and for the past 5 years in the healthcare sector, particularly the pharma healthcare sector. My thoughts on this are quite straightforward. I'll speak to it from two aspects as to how it affects the business as a whole and how it affects the people issue that has been mentioned. So what is AI doing for us? pretty much they are, if you're in the pharma space or in the healthcare space, you require a lot of unique, training and knowledge to practice there. It's a very wide area of study, knowledge body. The professionals that actually provide these services, be it pharmacists or doctors, are required to know quite a lot to be able to diagnose and to treat and to prescribe appropriately. What is AI doing in that area for them? You're able to, go through vast amount of, data compressed through AI to help, refine your diagnosis and help you aid in prescription. It's also great when you integrate those tools into your current working tools because they preemptively help you, with a few prompts, do all the thinking around all the active ingredients, what the dosage or the strength is, and what the best course of treatment should be. So that's where you see AI really step into the business space from a pharma and medical perspective. And so companies in that sector are beginning to look more as to how do we leverage this, to get, better information and better diagnosis and better prescriptions. So that's from the business perspective. From the people perspective, I think the major challenge most people have spoken about is the challenge around getting professionals. And, that is, something that is endemic, not just in the healthcare sector, but that is pretty much a Nigerian problem. And maybe not much more than just a Nigerian problem, but a problem is seen in a couple of other countries, especially where, people are migrating to look for, better economic opportunities. In that space, how does AI help, right? My, other members of the panel have spoken how they use it to source better, how they use it to, go through numbers of CVs, some analysis there for selection. Ultimately, where I think the biggest impact would be, in my view, would be on upskilling the talents that you eventually get into the system. And, AI being used appropriately would help us more of a personal coach if the business invests some time in structuring, the AI tools and the knowledge, the company's own information into AI tools, and also leveraging on what you have available on the internet is able to, do a better job at doing an on-site coaching for pharmacists or medical staff that are recruited. So if you're getting a new, pharmacist into one of your locations, you are going to need to upskill that staff quite quickly to be able to deliver at the level that you need them to deliver. And with the, the relocation, you have a depth of a number of people with, sufficient experience. Because typically most of the people that relocate easily are people with, 5, 6, 7 years experience. So you are losing the experienced, the trained personnel, and more often than not, we are being left with the younger graduates, now managing the system. So being able to use AI in a way that accelerates their learning, with the body of knowledge from the business and the body of knowledge available online, is where I think you will see the greatest impact on AI on the industry.
What are you doing though in that space? Then I'll use this to start back with you and come back this way again. What is the industry doing for especially that group of individuals that the older generation? Now you need to do a catch up for them. Has AI helped you in particular the tools that are there? Is it individualized kind of upskilling exercise? Are they receptive to this change? What is your experience from an HR perspective of closing that gap for those who are in the system now have to be able to do things a new way?
Okay, so I'll leave the bulk of that question to some of my more HR focused co-panelists. But how we use it is we have a lot of information around the drugs, the efficacy, the location of availability, and AI is helping with the analytics of logistics for transfers from one location to the other. It's helping with the information, the detailed information, on the SKUs that you're looking to prescribe. See, there's any contraindicators you need to be aware of and how you actually administer it. So it's more for, in that case, it's more of business intelligence and more for, improving the speed and quality of care at the locations. So, like I said, I will leave the more HR aspect for my colleagues.
So if you pass back, okay, here's another response further on. Thank you very much. Take it on.
All right. So we've had, a similar situation where we had to recruit some new set of sales people, and we needed to cut down the time to deliver, and meaning that we had to cut down onboarding.
Right.
So what we then had to do was to, use AI to shorten that, the learning curve, to shorten it. We had to, so that they have, on the feed coaching app that can just quickly let them know that, okay, this is what you have to do. If you have this kind of challenge, if you are faced with this kind of customer, this is how to go about it, and also that they don't need to defer to their line manager, for such. However, when we started, there was a bit of resistance, so as it is with every change management issue, so there was a bit of resistance. So when we saw this resistance, so what we had to do is we had to step back, look at what we didn't do right, and we immediately saw that what we didn't do right, it was to manage, was to handle the change management aspect of it correctly. So we had to course correct, get their buy-in into what we are trying to do, how it's going to benefit them, how it's going to help them, how it's going to make them more productive and all. And over a period of time, we then see that, we saw an increase in the use of, that application. So, and that has really helped us, in terms of monitoring, evaluation, and real-time, reskilling and upskilling of the team. Thank you.
So, all right, if you can also address it, because this was more the issue of that transition from in terms of skills, right? Those who do not have the skills. Now, I think Yolanda raised when she started that even the ones who come in, sometimes it's struggles to find the right people. So what skill sets, as you respond to that also, what skill sets do you see, you think are necessary for those who enter your industry now? What should the world be giving you so that you don't necessarily have to spend a lot of money preparing them?
It's interesting. I mean, when he mentioned the learning app, because it was something we had deployed recently. And so you have the opportunity where you have, and okay, 80% of our workforce, just to give you a bit of background, 80% of our workforce are actually the Gen Zs and millennials, which is actually quite interesting because they are quick, they're really excited about trying new things. So you don't really do a lot of convincing. And interestingly, the older workforce are actually also quite interested in learning new skills. They don't want to be seen to be, oh, do you know what, we're not free to change. And so we find out that there's not a lot of convincing to when you have new change initiatives that you bring up with the business. And with the deployment of AI learning software, so for instance, you have, which is I think happening a lot now, where you have gamification and a lot of interactive learning platforms. And so when you do that, you find that people are interested and they come back to you, oh, this was this. I'm number 3 or number 2 on the ladder. I think I'm one of the best. I'm going to finish at this time. And so people are actually interested because it's quite interactive. Questions are being, I have chatbots that actually ask questions, actually tell you where you are on the ladder. And so when you kind of use, when you have such a platform or a tool where people are able to interact on their own without necessarily have to sit in the classroom, or as he had said, go to your manager, and they can do this on their own. You find that people are actually excited to explore, those opportunities and see how well they can advance themselves. You had mentioned what kind of skills. I think for us, just some digital skill, or understanding of basic data analysis, or not everybody can have the skill of AI. But what we have done is just when we're doing our interviews, just having and understand that this person is open to learning. And so when you come into the business, we have a range of courses that are you must take. So it's compulsory. And we let you even know during the process, during the interview process. Look, when you come into this business, we understand, you know where we are in terms of you have to be a bit analytical. So you have Excel fundamentals are there, data analytics fundamentals are there. So when you come into the business, you do a kind of test just to see what level you are, and then you are able to deploy the learning that is suited to where you are, the level, and help you to grow from there. So yes, even though we expect you to have some digital skill or knowledge, we also understand that it's not really available out there, or some people don't know that they can take advantage of some platforms online, or it might be expensive. So we have said, you know what, let's just bring you in. When you come in, we also have the opportunity to develop, help you in your development phase as you grow in the business.
Let's help Yolanda back on to, because you started the conversation with the skill set acquisition, about the difficulty of those and the gap that is there. So which areas, if you were to say that they need to come prepared, ready, prepared, do the schools, the education system have to all of a sudden turn around their curriculum for how they prepare to post-mix it for them to come to you as in your sector, and is it happening? Is it likely to happen in a short while, or should the companies be taking responsibility for this transformation that's happening in the sector?
So you mentioned, whether we should be overturning the curriculum. That's a separate conversation that we can have now, because obviously we believe that the education system just needs like a total overhaul.
Okay.
But there's really nothing we can do at the moment. So what we do is, like you said, the company has to take responsibility for the people that they bring in, and sort of like map out the sort of development plan that they would sort of like initiate when these people come on board. So just to add to what she said in terms of the skills. So now at Eurocare, we have made it mandatory that when you come in, there are fundamentals, not because these fundamentals are not available in the higher institutions. So when you come in now, you have to undergo some basic tests, some basic training. Like she said, the Excel fundamentals, people are actually lacking in just basic Excel skills, and it's alarming. It's an
HR professional.
Yeah, no, just regular, just
staff.
Just staff. Coming in, people don't have, just because they think that they don't need it necessarily. The fact that you don't need it now does not mean that you won't need it later. So now there's this emphasis on just learning fundamentals, because it's very important to have those skills as you come into the business.
Okay. So Excel skills
with fundamentals.
Basic fundamentals. Yes. Okay, it's important for young people who are listening, right, to also know what is expected of them, because if they have to enter this phase, you're not saying as a health professional only, but it's also just going to be as a general worker within the system in this AI space. You need to actually these are the basic skills. But I guess onboarding becomes another avenue for you as institutions to actually do them. Have you guys used onboarding and we'll do that and then pass on to you? And for how is onboarding being done now? Have you changed significantly as a sector in the way that you do onboarding? Are there AI tools that you're using to enhance onboarding of your workers?
In terms of onboarding, I would say that for now we're still doing, just the traditional, just the method of onboarding. But I see that there's room for AI. We just don't know where to put it, at the moment in my organization. But as we grow, we would, obviously see where the gaps and then sort of like implement. But at the moment, we're just traditional, in terms of onboarding for now.
Okay. if you're using it, or how's your onboarding going? Has it significantly transformed? Are there any things that we should learn, even if either from your company or from the sector?
Well, AI and onboarding. That's well, the onboarding. How I would say it has changed is because as HR professionals, the onboarding, the point of onboarding is that point where you're introducing the staff to the organization.
Right.
So you're putting the staff through every necessary thing. We call that what's the name they call it? It's not at the top of my head right now. But having to use AI at that point doesn't seem somewhat necessary. But once the staff has already gone in well into the system, that's when the AI then comes in. So the onboarding is showcasing, okay, what gap. Okay, after some time, you're able to see the gap that the employee needs to fill in. But to a reasonable extent, you're able to know that, okay, this is what the employee knows and this is what the employee should know. Because, I mean, they're coming into a new system at the end of the day. So how are you going to introduce them to what's tenable in the organization? So AI has not been introduced in the onboarding session for now. It's still in the traditional stage. Thank you.
Okay.
So I just wanted to add, maybe I'm not Gen Z, but the onboarding process still requires that physical human interaction. I don't think there's a place for, in my opinion, there's a place for AI in terms of onboarding, because you still want to interact. You still want to have that one-on-one connection. Perhaps maybe during the employee journey, then you can introduce the AI in terms of engagement and all that. But at the point where the employees come into the organization, you still need to have that human interaction, physical interaction.
Yeah.
So I'm not sure if AI is yes,
okay.
It can come much late. I think
let's throw it. Olumide, both of you. I know that in your CV. I know in both your CVs you deal with this digital, Olumide particular digitalization, right?
Just what Yolanda has said, and I agree with her in the sense that you can't take that human aspect out of it. You can't. So, but I think it's also it's not a significant transformation for us, but it's when someone comes into the business, you have that interaction with everyone, like the HODs, you have the where you get to meet with everyone. But we also have, maybe because there's this training around the ARM, so you have bite-sized courses where they have to take to understand the organization, to understand. It just takes you through the culture. Right. So that's AI actually does that. It also takes the individual to how to use the ERM, so the software, how to go through your performance management, how to go through leave, how to request for loans, and so on. So it does that for us. So that's where we use AI. So the individual or the participants, depending on the numbers, actually see that and go through those courses, and you actually can log into your own profile, and then it takes you through, step by step, the courses. So there are some just very few, maybe soft skill courses like emotional intelligence. There's some courses that so when you come on board, say, okay, let's just take you through a few things and the culture of the organization. Yeah, it does that. How do you put in your leave? How do you ask for a sick day off? It does that. Then you also have the human aspect where each HOD comes and talks through the business, what they do, and so on. So that's human aspect where I think is important. Even though AI can be automated voice message, but it'll be better if you have that one-on-one connection, yes, with the business to sector.
Okay. So you're one of those who promote the notion that HR professionals are not going to lose their jobs soon with AI, right?
On the contrary, I think they're still going to be very important. Let me just see something as just counseling or coaching. I'm not sure I would want the AI to be counseling me, or trying to sit down at meetings and have strategic discussions around, or a staff coming into the business and you want to any person coming, and the first thing he has to be chatting with some chatbot around how to navigate business. I don't think so. I think the role of HR is strategic in the sense that you're looking at what are the trends, what is changing, and how can you actually align this to the business. So, okay, how is it going to impact different talent management? Should I say model in terms of, okay, how does it impact learning and development? How does it, even your employee assistance programs, how would you use AI to actually, make it better, more impactful, more efficient? And so you need the HR human to do that aspect.
All right. So let me just pass on. I'll come back to you. So this is your business, right? You digitalize. I mean, that's been what you spend your time on, digitalization of all these processes, right? So when you hear this, the extent to which we still want the human interaction in it, what is your view on this? I mean, how far do you think the sector has gone on? Has it been slow? Is it frustrating for you? Because it looks like, for me, when I look at your profile, that's what you spend your time on.
Okay. The way I look at it, some time ago, someone, a friend of mine, gave his wife a very luxurious car, very beautiful car, fully digitalized, powerful engine, good for safety, whatever you. But the wife was underusing the car. I don't want to go into detail. She was driving that car like a regular car. Now, this particular forum reminded me of that woman. You see, the way I look at AI, but let's say digitalization, right? It's a language that we cannot run away from. It's a wake-up call. It also drives my mind back to the event, the COVID-19 event. Wake-up call. It came, it met us suddenly, and we started scampering about. So there are times that, the topic talks about what does the future hold. But when you look at it, I tend to think that the future does not hold anything that isn't within grasp today, because it's always a trend. And when the rain is gathering, you will see it. You will know that this is what is about to happen, and you will have ample time to prepare. So from the HR units to the would-be candidates and job seekers, we have a huge responsibility to wake up to. And it can start simply in the sense that we're not running away from the reality that, for instance, there are two different kinds of brain. Most humans, our children, some go commercial, business, and the others go science. And it's always difficult to make some of the ones that are not science-based to start studying science courses. That's like a challenge on its own. However, some research was done sometime. I can't recall the name of the research company, but it brought something to the fore that when children are growing up, their brains tend to be very, very alert. In fact, in a genius state, such that anything you want to teach will go in. It's when we start growing that other things start interfering, then we start dying, in quotes, up there, and we start behaving like analog when we're actually really digital. The average human brain can cope with unbelievable things. We don't want to go into detail. Right. So when we look at this subject, maybe if we start looking at it as something we cannot run away from, one, something that must be done, two, strategizing around how would it be affected, three, and projecting by this time we should have done X. By this time, we should have achieved Y. It will become more realistic because the blend of people in workplaces will tend to tilt to their own background and their own realities. which tends to slow down what we'll call the overarching goals of the company. So like the HR, like I said earlier, is the bridge in any organization. And if the HR is going to be able to achieve X, Y, Z in this regard, it will be them and the management. Because, for instance, the management hires the HR people, so they are HRs. And the HRs now begin to bring in quality, which means they determine your return on investment. They determine the quality of your products. They determine your value. They determine many things, because the people that they bring in, they'll produce whatever the company is producing. So if we look at it holistically, we'll tend to understand that the future is always prophetic. And I mean prophetic, because prophetic is not really spiritual. It's telling of the future. So the future is prophetic, and prophetic is revealing. If you have an insight into something that's going to happen, that means you have tomorrow today. So if we have tomorrow today, we can do a whole lot by strategizing. Instead of strategizing around what's happening with sales, what's happening in marketing, I think we should zero into what will the future be like for this company. Where is this company headed? Considering the challenges that would come, it will come. If the whole world moves too fast or faster than certain other places like Nigeria, for instance, I don't know what will become of the companies in Nigeria. I don't want to say too much. Thank you.
Let me ask you to also deal with, when you earlier on you made a statement about change management, and your focus has also been people, having understood it from medical science, but also people. So this transition that we're talking about, that he says it's anyway revealing, it's prophetic, it's bound to happen. We have no choice. We have to live with it. The mindset that has to change in terms of that process of change management is not just about the employees, particularly the leadership of organizations have to take on this. So what is your advice to leadership in the health sector around just how to do that mindset shift? What is the mindset shift that you think is required in this industry? What should they be thinking different? I mean, he just says, look, don't focus on sales. Don't focus on this. Let's look at this organization. From your perspective, having people in mind, what should the leadership be focusing on in terms of that mindset shift? And then I'll go to Ernest and ask him about the quality of work, because I want to know whether this AI thing has changed the quality of work.
So for me, I think it's very critical for the leadership team in this emerging world, this digital world that we have right now, to actually focus first on people. Over the years, my experience, have shown me that you can't run a business successfully if you don't understand people. The customers who are going to patronize you are people. Those that are going to supply you whatever raw materials that you need are people. Those guys in the government who are going to regulate you are people.
Right.
So it then becomes critically important that as a business leader, you must understand people. And that's where HR comes in. And that's why no matter which age we are in, the digital age, non-digital age, one factor is very important, which is HR. So the mindset of the business leaders needs to change towards how HR is structured and how HR is positioned in the business. Now, I think, in the leadership team, HR should have a prominent seat where decisions are made, whether it's product decisions, financial decisions, or any kind of decision. You must have HR present seat. In fact,
like in my own organizations, I don't take any decision if I don't have the head of HR and all, because I want to look at it. Okay, so what's the implication for people, regarding this decision? What's the implication? So what do we need to do? What do we need to address? What should we be talking about? What should be our first step? What should be our second step? Because it is very, very important for anything you are going to develop, whether you are introducing AI tools, whether you're trying to introduce hybrid work model, leveraging on digital platforms. So it's very, very critical. And that's what is lacking in a lot of business, because you see a lot of leaders actually don't pay enough attention to the people. So it's not about strategy, financial ratios, some market ratios that are not related to the people. But what they've forgotten is that those financial ratios, business ratio, product ratio, customer rating, everything is done by the people. The quality of the people you have, the engagement of those people that you have, the connection those people have with your values and the business goals, and how it aligns with them. I mean, you mentioned that, in Regenesys, for every human, you're a spiritual being first, then you're an emotional being. So if you don't handle these two aspects as a leader, you can never win the heart of the people. And it is only when you win the heart of the people that they can go the extra mile, use their intelligence, use their potential, and get you results. So it is very critical for business leaders to focus first on the people.
So I'm just to pass it on to Ernest as I make the comment. Is that who else? You want to say something? Yeah. Okay. So, let's end the comment.
Yeah, just to add what you said, I think also in addition to the people, is also the leadership having a change mindset and just being open to, just like my colleague has said, hair transformation is inevitable. It's going to happen. It's happening already. So having that change mindset. But remember that when you're engaging leadership, even as HR, you must have your data. Right. So even if you're saying, oh, we need to go in this direction, you should always have your data ready. What's happening globally, what's happening, how it's going to affect us, how it's going to affect your sector, how it's going to affect people it has spoken about, and having a plan, kind of methodical plan or strategy around how you think it's going to impact different areas of the business and how you want to begin to face what you need to do. And so if you're working so even if you have a leadership that maybe is close-minded, but having your data on hand, having what's happening globally, that can also help, maybe to actually hasten that transformation or quick decision making, Right. So yeah, just
so can I stick with on this one? Because you spoke about those efficiencies earlier on. This in that sector, all of this is supposed to be efficient, and I guess what you're saying is that we can do for better efficiency, right? In the process of implementing and use of AI or implementing digitalization, has the quality of work improved? Is there evidence in your space that suggests? Because of HR professionals, I mean, you hear the passion from Abdul Karim that people have to come first, right? So we need to have people first kind of mindset if we follow that kind of framework. But has the quality of work improved?
Okay, short answer, yes, but I will go a little bit deeper. So, I mean, we've spoken a lot about digitalization and AI, and when we speak AI, sometimes people confuse it for just introducing more digital tech, which is not. It's a separate area altogether. So sometimes that is confused, but that shouldn't be. But why did I say yes, right? And why am I going deeper? So AI or digitalization is a tool, and they are there to make you be more efficient at what you are doing, right? To help you deliver better, to deliver your value. And most businesses do not do the prerequisite pre-work needed to have successful implementation or successful use, right? So if you take something as simple as an ERP, right, you are digitalizing processes that already exist. Those processes today may be done with separate systems or be done with paper and biro, Excel, right? And you are bringing all of those processes, onto one system for it to operate seamlessly. And so if you want to get success with digitalization or even implementing AI to your business, you need to start, from the very basic, which is the process that I'll be digitalizing. Have they been properly defined? Are they the best processes for my business? Have my people been trained on these processes? And does these processes actually give any benefit to the business, right? And so when you use digitalized tools or tech tools, what you are doing is accelerating the benefits you can get from running that in your business. So a lot of people haven't done the pre-work and they're rushing to bring in tech. And so you see misalignment between, now I have the tech, but I'm not getting the value that, I want to get out of it. So when organizations actually take the time to make sure that they are very clear on the objectives that they are looking to achieve, they are clear on the processes they're looking to digitalize, they're clearly defined and structured, and the people have been trained, bringing AI into the business and tech into the business at that stage gives you more efficient, outcomes for the business. So the quality of work just rises because, you can cut out a lot of the manual repetitive work and have your people focus more on the tactical and strategic aspects of how to move your business forward.
Yeah. So Yolanda, the digital tools, if we assume at the stage that quality of work or our quality of our workers is improved as a result of this, and there's data that's available. If we do proper audits, as you said, the baseline first, before we move into these things, let's actually understand where we are, and then we can transition, right? One of the things that's been spoken about, and I guess COVID threw us into it, and now companies are adjusting. Some of them listen to Elon Musk, and then they're like, okay, we'll follow him. Some of them, that guy is crazy. Let's do it our own way. It's this hybrid model. How is it going in your space, or as you look at the sector? Is it working or not working? What are the challenges that you're facing there? Because we're in it anyway. A lot of people, if I talk quality, some people say it's good quality. There's a lot of quality if I do in a particular way, or if I'm not here at work, what I can do from home, or I don't have to be in the traffic. That's my quality of life. What is your experience, of this hybrid model? And you can also, if you want to add to that.
Okay, so the hybrid worked for the time it should have worked. And I'm always an advocate for human interaction. So when I joined post-COVID, there was already the hybrid work model. But maybe because of where I am, I'm in a hospital where the human interaction is very useful and critical.
Right.
And so the hybrid work model didn't necessarily really work for us because it's a hospital, it's human interaction, it's patient doctor, it's all hands on deck, it's teamwork, you have to be physically there to provide service, to provide care. So
yeah. What about your HR professionals? Should they be there? Do they have to be there?
I ask myself every time, do I have to be in the office?
and
oh, because I just love to be in the office all day, all the time. But yeah, do we have to be there? Not necessarily. I've leveraged technology in sort of like making my processes more efficient, but I feel like I have to be physically there to sort of like drive it. Drive my processes. I can't drive it, remotely. It won't work, and that's because of the setting I'm in.
Okay, so let's hear from your experience.
Yeah. So in addition to that, fortunately, I was able to join the health sector COVID period, and trust me, the hybrid model is something that should be tenable. I think in different in the health and pharmaceutical sector. Especially not for clinical staff though, it's for we the back end. I'll call it the back end staff, as much as we also drive the business, HR and admin. So we operated on the 3 days at work, 2 days at home. And relating to what Ernest said, the fact that you're able to, you've already put out the objectives of the business, the values are out there, employees understand what they're meant to do. the most important thing that should be looked at is the performance. What is the output? So my own thinking is that no matter where an employee is, the output is what matters, right? What's the person bringing out? Whether the person is in Jalingo, as long as you are bringing out something good and optimizing the performance of the organization, it's and also AI too has come to help with that. So we have different AI tools that would help with attendance to ensure that your employees are signing in at this particular time. They're helping with performance management. So it's something that should be tenable too in the pharmaceutical and the health sector.
Okay.
Most especially for back-end staff.
All right. Thank you. So for back-end staff, human resources, professionals, this should be like, we don't expect a doctor to try and not be
exactly, yes. Gone are the days where work till we drop. No, these things I would always call it work-life harmony, because infusing the both of them to create a balance for yourself. But the doctor is not like they're at work 247 now. The doctor comes in to take over the shift, so it's also goes to them as well.
For primary health care.
So while I said I sort of strip the hybrid work model because you can't provide care to a patient remotely. But what I've done is that now I have made the workspace much more comfortable. In terms of so quid pro quo. I bring them in. I've now made their lives somewhat better, somewhat more comfortable by providing more benefits. That will be useful to them. So
I mean, a radiographer and a specialist radiographer, doctor, or one who works with radiography can do diagnosis of somebody who's sitting very far away, right? Just as long as there's a tool, there's a nurse over there, and you don't have to have a nurse direct or a doctor everywhere, right? So in that space, we can see the benefits of that, right?
There are benefits. So, like for instance, you said in our radiology department, we have the radiographers that are there, but the lead radiographer sits all the way in the US, so they are there physically to do the scans and then send the images,
and then the diagnosis is made,
and
the prescription works for anything because it comes quicker, right? So do you want to add? But then Faith, or make your comment, and then Faith, I want you to add on: should we trust this data now? You mentioned comment earlier on about social media searches and all of that. Can this be trusted? Right? Now I'm talking AI governance. Can this be trusted? But make your comment. You were commenting on this point.
Yeah. So I think the let me say the hospital aspect of the health sector didn't actually take full advantage of the benefit of that COVID period, because during the COVID period, a number of people could actually not visit the hospital, and people were still getting healthcare. And what happened was a number of people leverage on telemedicine, call the doctor, speak to the doctor, and it's only when the doctor feels that, look, this is a very critical thing that I need to examine you physically, I need to have a feel, so they then tell you to come to the hospital. So that actually helped with management of the crowd that you see in the hospital. But what had happened was immediately after the COVID, they just threw away all those things, all those gains. They threw it away. Otherwise, like she said now, you don't need to get, a consultant radiologist on the ground, to look at your x-rays. That's going to increase your cost as a business. But if you leverage on the technology, telemedicine, you can hire one professor of radiology somewhere on a part-time basis, and then you have just the radiographers who can be on ground, shoot the film, send the film down. Same thing with laboratories, looking at results and all. So these are things that the hospital aspect of the healthcare sector would actually leverage on, to manage the crowd that comes into the hospital, because medicine, there are certain diagnoses that have been very standardized in medicine. They've been standardized. So nobody can change it. Whether you are a professor, this or that. So they've been standardized. So those kind of cases, really, you actually don't need people to come into the hospital. to see a doctor for. And those cases are responsible for 60 to 70% of the reasons why people come to the hospital. So you can actually become more efficient in the hospital if you leverage on telemedicine. So that's just my point. Maybe you should start thinking about it.
Yeah, it's also about the state deals with the governance of this, and I invite anyone for any questions online. With the point you're making that if we use the advantage of this technology, actually be able to work into the hospital, put my finger there, and you read a lot of data from it, right? And by the time I get into your room, consulting room, there's already data that tells you my blood sugar is low, my BP is this, and my stress levels are this, and you're able to move much quicker to a diagnosis and a thing. And that's the advantage on that side. Can this be trusted? Now, on an HR side, maybe not on this medical side, because there's a lot of research there. We, as HR professionals, can we trust the sources that we use, from recruitment tools that we use, the on coaching data thing that we use? Can we trust them?
So I think it's a bit broad, but maybe I'll just narrow it down to, let me see, recruitment. So, for instance, I remember that for data, just as my colleague have said, we put in the data, and so if you don't put in clean data, it's garbage in, garbage out. And so, for instance, if I'm doing a screening and I'm using an AI tool for screening, and I've done my shortlist. Typically for HR, you're going to also do your background checks. So that can actually help to screen out. So you can't, I don't believe at this time 100% trust AI, because I believe people would always want to manipulate AI for their own benefits. And I know that, of course, that's why there's a lot of governance, a lot of rules or regulations around governance. And for us in HR, annually there's cybersecurity training, everybody. And for everybody that comes in, you must have that training compulsorily. And so just understanding what are the risks using AI, what are the risks with accessing information online. And so everybody just has an understanding of what to look out for, what to watch out for. And then for those who have been in the organization, there's refresher half year. So people it's just in your mind to know, yes, this is fantastic, it's nice to have, it's efficient, your processes. There's almost an 80-90% accuracy, but also know that there are people that are going to manipulate these tools to their own advantage. And so HR people being aware of this, ensuring that there's the right training, ongoing communication, working with your IT team, the data and BI team to ensure that the right type of training is done, people are aware, and it's kind of top of mind. 100% trust, no.
Whilst we pass on the mic to Olumide, is there any questions that we have on this video? Even if there's a question online, please help me to deal with the questions online.
This is Bennett.
Hi.
How does AI help in drug development?
Okay, all right. So the use of AI in that space is pretty common, and that's because when you're formulating medicines, you're formulating, medical treatments, you have to do a lot of iterations on how you're going to combine the different molecules to get the optimal result, right? And you also realize that there's a lot of medical research out there in bits and parts that are going to play into the body of knowledge that you need when you are striking out to do a new treatment. So, for example, if you are doing something for treatment, a cardiovascular treatment, for example, you would typically need to understand what body of work is out there in terms of cardiovascular health, what kind of treatment options are out there, what are the active ingredients in there, what are the mixture rates in there, what are the efficacies of those particular drugs, what are the trial outcomes that they have, right? So even when you want to do a new treatment, you have to rely first on understanding what the existing body of work and synthesize that data, and then take that into consideration so that you're not basically doing the same thing and wasting a lot of research and R&D. So AI basically helps, drug manufacturers synthesize all those data, and also help them work out new possible formulations that they should consider. And so that helps to bridge the gap between the timeline for drug development, which takes quite a bit of time. It also helps you to consider what the potential efficacy of the drugs you are formulating would be. So that's really where you see AI doing a lot in that space, because you have to manage and go through a lot of data, and then you need some predictive aspects of having gone through this data. What kind of active ingredient should I be considering? What kind of formulation should I be considering?
Yeah.
What kind of delivery system should I be considering? Which are all relevant information for companies looking to work on developing new drugs.
Has the sector taken advantage of, I think what we've heard in the hospitals and others have not taken advantage of post-COVID? Because during that time, people found other things, ways of managing, right, their respiratory challenges, right? And most of those were very much traditional methods. If the pharmaceutical industry moved into actually, let's check the efficacy of X, Y, and Z. Because I can see these days, even on Instagram, people are challenging the kind of combinations they have. They say, why do you have magnesium with this? Magnesium is better with that and not this. So somewhat that sector has been challenged in a way that you actually, put together your chemicals and what is effective and not effective. But also people are using their traditional knowledge. Has that been affected by this kind of changes that we see?
Yes, there's been an effect, but it's a good and a bad effect. Anybody in the medical space, especially doctors or pharmacists, will tell you that it's not enough to just go on the internet and read all sorts of data. You're not sure who's posting the data. You're not sure if it's peer reviewed. You're not sure if it's efficacy rate. And people are more often than not now just putting out the suggestions out there, and they're actually writing it as actual medical facts, right?
Right.
With studies and research behind them. So in some ways, having all this information out there is good for patient education, because you should understand what is being prescribed to you. You should have a good idea of what the expected effects and the side effects should be. But, and that also accepts patients to actually, give better patient history to the hospitals. I've tried this, and this is the outcome. So in some ways, it's been positive, because there's a lot of patient education, but there are a lot of negatives to it as well. You see people self-medicating and trying all sorts of combinations without fully understanding that what works for person A and person B, may not work for me. So, for example, when you look at even just between the races, what you would consider acceptable heartbeats, what's considered acceptable heartbeats per minute.
Yeah.
It's different for a man and a woman. It's different from a child and an adult. It's even different between Caucasian race, the African. So it's different. So sometimes you're just seeing research out there, and without the right context of a medical professional or a pharmaceutical professional, people are trying all sorts of things that are injurious to themselves. So one is good for patient education and allows them to, actually ask more guided questions to their healthcare professionals to make sure that they're on the right track. It's also had its negative effects. So I think we need to take it, understanding that it's a bit of a cutting a double-edged sword in that regard.
Okay. I guess there's a lot more we can go there with. Is there a question there online? Is it online? Okay, let's take the one online. Sorry.
For your company, said, will AI ever help to bridge the gap in the need for health workers, like that sector, which will be bridging the gap with AI?
Did anybody get that?
Yeah,
like actually the workers from the health sector in AI bridge that.
Okay, so yes and no. Some aspects of the job, like they said, you actually need people physically on ground. So there are some aspects of care that you will never be able to provide remotely. But that being said, there's a lot more aspects of care as time is going forward that you can provide remotely, right? At the moment, they're touting, remote surgeries, even surgeries that can be done, just across high-speed internet with somebody manipulating a tool from a different continent. Right. So There are advances that would mean that you don't necessarily have to have the person conducting, the procedure, some part of the care physically in that location. And we've also mentioned where you can have, share resources, like have a consultant radiologist, interpreting, scans from, different hospitals. So in some ways you can bridge some of that with the use of technology. Also, that's where AI is also very, very good, because if you look at the predictive accuracy of AIs, you see that they are showing, in most cases, in recent studies, higher accurate diagnosis than actual on-site doctors. So in a lot of ways, and for some of the care, AI is going to help bridge that gap. But you just have to be aware that, for some care, for example, somebody sick on the hospital bed, without a nurse being there, or a doctor being there, in some cases, there's nothing you can do. So yes, there are some aspects, and that's what we need to think about when we think about the use of AI technology as a whole, right? There are some tasks that they'll be better at. We need to identify what those tasks are. We need to give them those tasks to do and free ourselves to do more of the tasks that they can do.
Okay, so menial tasks and tasks that can be automated must be. The last question over there, and then I'm going to ask my panel to do closing comments, because I know we've run out of time.
All right, so it's actually similar to the question Charles right now. So I wanted to ask, since the brain drain or the job challenge is affecting the health sector seriously, so on the HR level, how is the HR able to address that concern of having the doctors, the nurses living at every point in time? How are you able to manage that challenge? And then you also know that because of that, the experienced ones are living, and the ones that are in the system, some of them are not as experienced as those that are living. So how does that affect the system? Is AI able to help those less experienced ones that are still here in any way to manage the challenges?
So it's in a space of talent management, I guess. Right? It's talent management. Are those tools available to help us with talent management? And maybe you can make your closing remarks as you do that.
Okay, let me just chip in this. The extent of investment into AI as we know it is very, very broad. And there's rarely any situation. It depends, like I earlier on said, on pre-programming. For instance, there are situations where we have on a training page where footballers are playing football, you have an AI, a robot, tapping the ball with them, and it does it better, because when you think of AI, you're thinking of perfection, except an information that is not preloaded. And most of the times when it comes to health, like you asked, it's always more detailed. Whatever it's been, and it's always being updated. For instance, if this were to be a hospital and you have an AI, maybe in a ward, once there's distress, the AI can pick it, because it's preloaded with maybe somebody's not supposed to be up at so time, and the person wakes up. That's why I said it's human intelligence, but on a mega level. It's like adding your brain to his, to hers, and on like that. And the information that we've had from back in the time to this time, and whatever could still be loaded into just one robot. You want to think of the immense ability that robot has. It's unbelievable. And that's why if you watch some movies where they want to actually maybe get rid of a robot, maybe for some reason or the other, before that robot will go down, you must get maybe one chip of it. Even if all the body parts are going, it still has a goal. Unlike a human being, for instance, maybe a human being, a medical doctor is actually attending to whatever, and maybe the medical doctor has had a challenge of childbirth. And it came so long, but it came. Then suddenly he wants to attend to some patient, and he told him from home just before he entered whatever. that your son just died. Regardless of how he manages it, it's still compromised. But an AI is unbiased. It has no emotion, but the emotion built into it for a goal. So when you begin to analyze what an AI could do, what the question should even be more of, what is it programmed to do? We all came here via automobiles. When you press the brake, it responds. When you press the accelerator, it responds in a different way. So it's programming. It's all about programming. And if you have an AI that is well programmed, I assure you, not trying to say that we are actually departing from humanity. In fact, during one talk some time ago like that, I said if only we could be calling AI with an H, maybe with a small H behind it, and just say hi, so that it seems to be like a human artificial intelligence, because it's still human. Whatever humans have been able to produce or manufacture is essentially human. It's produced to meet human needs, and that is what the goal is all about. An AI will not get tired and feel sleepy. We've heard of situations where people forget scissors in someone. An AI will not, I don't want to go into too much detail, but if we're talking about the positive side of AI, we don't need to be insecure. Neither do we need to be, a little bit reserved. If you program it well, such that like airplanes, if an engine goes off, this one comes on. Yeah. For human beings, it's not like that. If something goes on, like maybe a doctor has a stroke in the middle of a surgery, the surgery has failed, and the hospital will not be sued because the doctor failed, and the patient also failed. But it won't happen with an AI. So I think maybe I attended to your question.
Thank you. Let's do closing remarks.
Thank you very much. I like putting this 180 overwhelming confidence in AI, which is like it's infallible, but I mean that's discussion for another day. I guess maybe some of us have watched a lot of sci-fi movies where you see the AIs are taking over the world. So like it's weary and just watching it carefully. But I like what you had said when Ernest had talked about remote, maybe someone monitoring surgeries remotely, and they had talked about the robots actually being there to, AI robots doing operations. And I believe that's going to even happen much sooner than we think. And even though you had said we shouldn't be looking at so much data online, but there's a lot of information about how many doctors are we going to need in the future when you actually have robots that can do this and even do it more efficiently and more accurately. So for us in HR, I think just as my colleague had said, is being there when you're having those conversations around AI and looking at the employee life cycle. So looking at the whole talent management process. So let me give you an instance, maybe some of the critical pillars from recruitment, workforce planning, recruitment and onboarding, learning and development, performance management and feedback, as well as employee well-being. So how can you integrate AI in those areas? What can you do to ensure that HR processes are more efficient, more accurate, more effective, and so improve the overall employee experience, when they come on board into the organization, so whenever they depart. So just having AI integrated into processes and working with leadership, looking at strategic organized business goals and working with leadership to see how whatever area, whatever department AI can support, and of course we're going to be championing change, championing communication, championing learning. So there's a lot of, a lot that HR is going to do, but it's also exciting in terms of HR.
Excellent. Thank you so much. Closing comments.
All right. So I know we've talked about AI a lot, but so that we don't just make a conversation about AI, I think it's a lot more expanded. It's about the digital world. AI is just one of it. So we must recognize that increasingly, permits me to use the word, that the world is becoming more vulcanized. We're living more in a more volatile, the world is becoming a lot more uncertain, different, a lot of them becoming more complex and ambiguous. So HR, as a professional course and of course a professional business is becoming a lot more important, to businesses across the world. First, so in a digital world, HR needs to start thinking, okay, so how do we redefine ourselves in HR? So they need to start looking at what's our HR digital strategy to be able to support this business. So in which aspect of the HR strategy do we need to, be more digital? In which aspect do we need to be hybrid? And in which aspect do we need to be traditional based on, current reality? So, and then HR also needs to then begin to support the business itself, to engage in conversation, to begin to ask the business leaders, okay, so what's our digital strategy as a business? So where do we want to go? Where do we need to digitalize? So how do we get the people involved? How do we get the buy-in of the people? How do we win the heart of the people so that the people can support these digital initiatives that we are putting in place? Now, if all these are not in place, whether you're trying to create a process from, what Ernest has talked about, or you are trying to introduce a digital tool, all is going to fail. So for you to be successful, the first thing is HR needs to reinvent themselves, and then HR needs to get more involved in the business. Thank you.
Yolanda? Future for this, for you.
Future.
HR.
So just to add to what he said, AI has come to stay. AI is useful. In terms of HR professionals in this age, I think we now need to be more intentional. And I like what he said. We now have to be more focused and more strategizing, thinking, okay, how do we going forward? How can we make our processes more efficient? How can we sort of like leverage technology to make our processes efficient? So I would say in closing that HR professionals in this age should become more focused in leveraging technology to improve processes forward.
Thank you very much.
Okay. Well, the thing is, right now, the stage we are now, you can see the change AI is bringing. So how do you think it's going to be in the next 5 years? It's going to be like, right? So the question is, are we actually really open-minded to receive what is coming? And as a HR professional, we actually should try as much as possible to stay relevant, to know and understand what is coming our way. As I mentioned, like there are a lot of things that is prophetic, where we can see what is going to happen in the future, right? From what we can see now, right? So are we open-minded to see what is coming our way, and we're not like scared to be like, oh, HR is here to take our jobs? No, we should be open. And also the emphasis on people that he mentioned. How well are you as HR professionals? Are we going to use AI to make things simpler, to make things more efficient for our people? I think I'll leave us with that question.
Yeah.
That's it for me. Thank you very much.
HR people have been onto paper for a long time, right? We've been making them drive paper for a long time, and now here are tools that are meant to make life easier for them. All right, I've overextended, and I think I've dominated enough the stage, but I hope those who are online have also been able to have their questions answered. Let me take this opportunity for myself to just say thank you to the panel. I think it's been engaging. I think the future of HR in the health and pharmaceutical industry in your hands is in good hands, because there's a lot of open-mindedness and a lot of you understand the cycle very well, and you are able to see the tools that are being used out there. And of course, all of these things can be brought from private sector into the public sector to a great extent. We are universal citizens now. We should be, we will be attracting staff from all over the world, and our people are going to leave, whether we like it or not. When we train, we don't necessarily train for our companies, although many people think so, but you don't train for your company, you train for the universe in a way. So our job as we transition, we actually must know that we're making the world a better place. And that's, I guess, the role of human development and training. I'm going to hand over to our country manager, Vivian, to do the pleasantries and close the session. Thank you very much from my side. Truly appreciate. Thank you.
I want to say a big thank you to those of us who have participated at this event online and here presently, and to our exceptional and amazing speakers who have, made our time out of a busy schedule on a Monday morning. I know how busy it can be. We say thank you on behalf of Regenesys. Thank you very much. I believe that this event has been quite informative, educative, and insightful. I've learned something new, and I hope my colleagues, friends online here have also learned something new. And on behalf of Regenesys, we have something, just a token for each of our speakers. Please accept it. Thank you. Yinka, right? Thank you so much for coming from Dutu. Yolanda, thank you so much for coming. Mr. Abdul Kadri, thank you so much for coming. Faith, thank you so much for coming. We appreciate you. Olumide, thank you so very much. Ernest, thank you very much for coming despite the short notice. Thank you very much. We have something. Please help yourself. We look forward to discussing. Thank you. Picture.